It's Malcolm Fleshner. I'm here for TYT Politics at the National Nurses United Convention in San Francisco. Bernie Sanders just spoke, and I'm talking to some of the nurses who've been in attendance. I'm with Catherine Kennedy, who's a nurse from Sacramento, and I wanted to ask you what you thought of Bernie's speech.
Well, of course, he's always marvelous. You know, I love Bernie, and he speaks the truth, and it's all about guaranteed health care for every American, so I love it. I absolutely love it.
So one of the things Bernie talked about is that this fight, Medicare for all, for single payer, is a battle sort of for the soul of this nation and what it means to be an American and what America means. And what he was talking about is whether we consider health care a universal right or a privilege for only those who can afford it. Does that resonate with you?
It absolutely resonates with me because as a registered nurse, things that I see and my colleagues see every day is when people have to make a choice as to whether or not to face financial ruin, to make sure that their child gets the care that they desperately need, and they make that decision. And, you know, elderly patients that maybe cut their medication in half to make it last a little bit longer because their prescription is too high, and then, you know, in order to even pay their rent. So those things we hear about all day long. You know, there was a man who collapsed at an event that we had, and he begged us not to call 911 because he financially could not afford the ambulance ride. That's ridiculous. So what Bernie Sanders said here today, it's absolutely imperative that we guarantee health care as a human right and not for just a privilege.
And as a nurse, do you feel like you went into this profession because you care about people, you want to help people, and did you have any conception about the financial side of this industry and how people would have to be making these kind of life and death decisions over money when you were trained to be a nurse, or is that something you were aware of?
You know, I started my career 37 years ago, so I was a naive 23-year-old person. And, you know, also being a military dependent, I never had to worry about health care. So now you fast forward, and here I am, you know, close to senior citizen, and I'm looking at this, and it's about profit. You know, even in our hospitals, they're talking about value-based, you know, market share, as though human life is a commodity. We're not for sale. This is about health care. We need to take the profit out of health care, guarantee that anybody that walks through our doors gets the access and the health care that they absolutely deserve.
Now, so you said you've been a nurse for 37 years?
7 years.
In that time, have you seen a shift in the way people within the medical profession, nurses, doctors, administrators, the like, think about the possibility of single payer? Because even when Bernie started talking about this, it was a non-starter for most politicians. Everyone's saying that's pie in the sky. Hillary Clinton described it as like a pony, wanting a pony. Have you seen a change, a shift in the industry?
Yes. We have physicians that are behind a national health care system. We have even small businesses here in California, as Bernie Sanders said. Small businesses would be, you know, the idea of having to not worry about health care for their employees. That's a gain for them. So yes, it is shifting, you know, and I think that everybody now sees that, you know, again, like I'm going to tell you again, it is not something that you profit from. You know, we're in the business of making sure that people have what they need, and that is the most important thing. So there's a groundswell. Americans want this. We're going to get this. It's going to get done.
So speaking politically then, I mean, the nurses, your job is to provide health care, but the nurses union, part of it is a political job, and we have 2018 midterm elections coming up, 2020. Where do the nurses stand on whether single payer Medicare for all is a litmus test that any politician who does not support those will not get your support? Do you stand behind that?
Yes, I do, and absolutely. That's going to be one of our key questions. Are you for the people or are you for the insurance industry? It's got to be about the political will to do what the constituents want and need, and that's to guarantee comprehensive health care for every American. And if you're not on the side of the people, then you need to move out of the way because we're going to get somebody that's going to do the right thing.
What about politicians like Joe Biden who say, well, let's not move so fast. Slow down, take it easy, don't rush things. That message is not, you're not with that?
Time is of the essence. We need to do it now. People are dying right now. People are suffering. We're rationing health care. They're making more money. It's got to stop.
Well, Catherine, thanks so much for talking to me. I appreciate it. And thanks for coming out here and supporting Bernie and single payer Medicare for all.